So 1 minute past the hour is a perfect time to commence. We've got a short, sharp session today on wellteq digital health. Introducing myself, I'm Scott Montgomery. I'm the Chief Executive Officer of wellteq. We're a CSE listed digital health company under the ticker WTEQ and on the OTC WTEQF. We are a recent listing in March this year. Very exciting proposition coming out of Asia Pacific, where we compute all different types of health data into a personalization engine to coach health behaviors for employees and for insurance policyholders. The company is a corporate solution out to over 30 countries, 12 languages currently, and we're going through an exciting growth phase out into the markets at the moment and expanding from a well-being and a wellness offering exclusively down into a deeper continuum of care. We've recently had the appointment, and we're very proud to announce the appointment of our Chief Medical Officer in Dr. George Gellert. Dr. Gellert is based out of San Antonio in Texas and comes from a deep history in Chief Medical and Chief Medical Information Officer roles as an executive physician, working for such companies as 3M, for H Corp, for WebMD, and for Corpus Christi. So I will very, very proudly introduce George for a bit of Q&A today, following a brief presentation around the key priorities and a couple of core questions around wellteq and our expansion into bringing clinical expertise to our corporate customers. We'll jump right into it. From your perspective, coming from decades in the medical and the clinical fraternity and the pandemic and around, why is wellness and specifically why is wellteq more strongly positioned now due to the COVID-19 pandemic?
Well, the pandemic really has changed dramatically the whole unfolding of telemedicine and the emergence of remote patient monitoring. These technologies existed, of course, well before the pandemic and were being provided, but their level of reimbursement by payers, as well as their general acceptance among both the public and clinical providers, was quite limited. And with, of course, the pandemic, requirement for social distancing has brought these technologies into not just the armamentarium of contemporary healthcare, but as a centerpiece of it. Without remote technology, without telemedicine, virtual health, the infrastructure and processes of delivering primary care as well as specialty care would have completely fallen. And as a result, the impact, if you will, the silver lining to the very dark cloud of the pandemic has been a tremendous acceleration in the adoption, the acceptance, and the innovation of telemedicine and remote patient monitoring. So much so that I think it's fair to say we will not be going back to the pre-pandemic level of slow emergence. We're now going to be going through a period of great catalytic growth in telemedicine and remote patient monitoring, one in which wellteq is ideally situated in terms of its existing assets and its growing capabilities.
And how do you see the entire system itself changing? We're coming from a base of almost reactive healthcare, and now we've had to go through this acute coping space. How do you see the entire system transforming with its infrastructure and approach and its system?
Well, besides the innovation of technology to make the use of telemedicine or remote monitoring more acceptable and easier to accomplish for both patients and providers, this has an underlying impact of shifting the entire framework, if you will, of healthcare delivery from reactive, post-injury or post-disease intervention to a much more primary prevention orientation. Because what these technologies allow is for ongoing monitoring and engagement of individuals with very minimal cost and time commitment. So for now, for example, we can be engaged with someone who, for example, is, say, a pre-diabetic, has emerging metabolic disease. We can engage with them in a much more multidisciplinary way
Mm,
with fairly intense educational, prevention, and wellness resources through telemedicine and remote monitoring and virtual healthcare engagement. This will allow patients to get, if you will, much easier, faster, and more regular attention to their needs, whether those needs be educational, risk reduction, behavioral change, compliance and, with therapies and medication adherence. So the whole framework of healthcare delivery is increasingly going to move what is today very tertiary and only hospital-based care into more ambulatory settings, and care that was previously in ambulatory care settings and primary care offices of physicians will now move to the home and the workplace. And again, this is something that for years now, WellTech has been building a systematic framework and technological capabilities to engage this, which now we've been really accelerating through key acquisitions and new partnerships and agreements. So this focus on wellness and prevention is very much going to be far more central to our healthcare process and healthcare delivery, as well as reimbursement incentives and penalties for in reimbursement than it has been historically thus far.
So we're bringing the proactive capabilities and the continuous data monitoring of wellness and well-being and digital well-being specifically into a healthcare form, and that's interesting to a multiple set or a myriad of corporate payers and stakeholders. So if we're looking at WellTech specifically, how how differentiated are WellTech from other corporate wellness peers, and how would you describe that from a clinical perspective?
Well, WellTech is strongly positioned because it has a baseline platform and interactive engagement space with users that has been well developed, that is now advancing through two new key projects, Project Positive and Project Shape, focusing on stress and anxiety reduction, mental well being on the one hand, and fitness and weight loss. Weight maintenance, correct weight maintenance on the other, that really are going to advance the impact, the systematic impact on individual WellTech users, and thus, of course, value and ROI to our corporate customers uh, whose employees are our individual users.
Mm,
Uh, in addition, WellTech is very much differentiated by virtue of being already a global company based in Singapore, in Australia, in Canada, increasingly in the US, New Zealand, with capabilities, customers, and talent drawn from those markets. We have a footprint that allows us to grow organically in a very dynamic way. From my point of view as an epidemiologist and a chief medical officer, of course, this provides a wealth of comparative data for our evaluation. Is at WellTech, we fundamentally are investing, building our new platform to capture data at a populational level as well as an individual user level that will help us drive outcomes demonstration, quantitative and qualitative outcomes demonstration, both to the individual end user so they can metric how they're doing for their efforts and their engagement with our technology and our offering, but also for the institutional customer so they could
mm.
see for their population of employees or population of patients, how is it going? What value are we getting? So, having these different national projects and implementations allows us to do some very interesting compare and contrast of different populations and subpopulations across the world, literally. And that will make our data analysis and our demonstration of outcomes that much richer and more meaningful for both our end users and our customers.
So, from a commercial side, which the investor community understands very well, and where I'll speak to is that with the land and expand approach that we have with our corporate customers, going into a territory or a region, and then expanding WellTech across their multinational footprint. From a clinical perspective, we're actually doing we're taking a very similar approach. So we come in through a relatively easily onboarded level of interest and simplicity around mental health and around physical health, and then we expand that value to the user in a range of different modalities and through partnerships. And so, from that clinical perspective, the land and expand to start something small with health improvement or health mapping, and then to coach people towards very specific health outcomes is how we're going.
Absolutely. And the actual technology strategy that we are utilizing facilitates that
Mm,
uh, by creating a very multimodal sensing device or wearable for end users, and then having a technology hub which can literally integrate readings and transmit data from virtually any device that a patient or an end user could connect to it. That enables us to capture many more variables, many more outcomes and contributors to either ill health or well being and wellness. And that technology strategy is being purposely developed to be entirely agnostic, not just in terms of interfacing with other technologies, but eventually interfacing with electronic health records. Whomever, whomever the vendor is that a particular customer may have in terms of their electronic health record. Also being agnostic in terms of kinds of devices that can be connected to it to measure, for example, risk factors and ongoing clinical performance in caring for hypertension, for example, or maintaining appropriate blood or serum glucose for a diabetic or metabolic patient,
mm,
and so on. So the technology strategy is as diverse in its conception and in being agnostic, readily implementable in numerous markets across numerous disease states and to avert or minimize numerous risk factors for chronic diseases. And that is the ultimate big win, correct? We must, appreciate that across the world, even in emerging economies, chronic diseases now are the disproportionate burden of
mm.
both preventable morbidity and mortality, but also preventable healthcare utilization and costs associated with that healthcare utilization. So, by focusing across multiple markets that it's already well penetrated in, by diversifying and making agnostic its technology strategy, and by focusing rigorously on quantitative and qualitative impact evaluation and performance monitoring for the platform, wellteq is really coming up with a very powerful solution, which is, uh, I think, almost unique in the marketplace.
Yeah, I mean, there's a huge need out there, and coming in very simply and expanding with those corporate clients, expanding out into a more clinical offering is a big task with huge reward, and already on that pathway. How would you describe very simply the the clinical priorities for you in the next 2 to 3 quarters? There's a lot of work in there. You've already spoken to some of the work and the focus, but what are those priorities for you on a clinical or a medical perspective?
Well, two of our primary initiatives at this time are what we refer to as Project Positive and Project Shape, dealing respectively with stress reduction, anxiety reduction, mental well being, and health on the one hand for Project Positive, and in Project Shape, weight reduction and appropriate weight maintenance. These are being selected both because they are so pervasive from an epidemiological perspective. These are substantial morbidities that are commonly experienced across all our markets. We're also focusing on Project Positive, particularly on patients and families that have been affected by the COVID-19 pandemic.
Mm,
We recognize at WellTech that COVID-19 is now going to become eventually, hopefully, endemic as opposed to epidemic, and become, if you will, a part of the existing healthcare systems of most of our markets, if not all of them, and indeed on a
mm,
global basis. And we need to recognize that with COVID long haulers, those who were admitted into hospital and ventilated for long periods, there are going to be long term wellness and health considerations where we can add value that are related almost entirely to their COVID-19 experience. So that remains a priority across all of our new product development. We're also working to innovate with practicing physicians. We have a project in Spain, for example, where we're going to have the ability to roll out and test and implement our emerging technology with practicing physicians in a dynamic medical community. And of course, our technology strategy continues to evolve to keep pace with our substantive development of risk reduction and guidance programs for end users. So these are all critical components of an integrated strategy that is positioning WellTek in the next several quarters and certainly in the coming years to provide a broad range of capabilities to institutional customers, to strategic partners in healthcare delivery, in populational health, and those who are in technology fields that have part of the solution but need a matrix or a fabric in which to embed their technology to create a full experience for the end user and a full value proposition for the institutional customer. So WellTek is well positioned to continue advancing its DTC offering to institutional customers for their employees, for example, at large companies, but also serve as a partner, as a vehicle or a channel for critical partners in healthcare delivery and healthcare IT to deliver their value propositions in a more robust and comprehensive manner. So those are all our key priorities for the coming quarters, and we continue to evolve as we move forward.
Yeah, perfectly put. And I think what you've described there is certainly how we bring together the technology and the clinical or the health side, and with your knowledge, your expertise, and your fraternity is connecting with that clinical and medical network. So we're baked in evidence. You know, we're regulatory very sound, and then we translate those health outcomes into ROI for our corporate customers. And they can be employers, and they start from a range of $814 return on every individual per year north. And the more comorbidities or the more serious those risk factors are, the higher that return goes from there. So there's some real dollars and cents that are wrapped around the health outcomes that you're pulling together. You've already referred to the work in Spain that we'll be undertaking with Frontier Wellness, and to their 140,000 health practitioners up there as a new geography and a new territory. Stitching together that with the largest fitness community or fitness studio community in the world with ClassPass, and then Garmin, the front runner certainly in the fitness and general wearable component. So we're pulling together the biggest brands, and then using that data and that clinical network from your perspective is to ensure that engagement and that return is delivered to the corporates, but with the health outcomes for the individual, which is most interesting.
I would add
So
one thing to that
yeah,
we haven't yet discussed, Scott. We are really looking at our user experience to reconfigure and evolve it in a way that we think is unprecedented, focusing not just on metrics, not just on health promotion, wellness, or risk reduction objectives. Of course, those are integrated, but we're focusing on creating a multimedia experience for our end users that is going to really be focused on what is the meaning of engagement for our end users. Why are they utilizing our services? Uh, how is it meaningful for us to help them advance their health status, their well-being, their fitness, cope with chronic disease risk factors or already existing chronic disease? And we are building this in a manner so that the very experience of navigating through our functionality and our clinical content itself becomes part of the resonance that we wish to create, resonant meaning for our end users. And this is fundamental because if you don't have that to the highest extent possible, you're not engaging your end users in a process that they can maintain and sustain, that they find rewarding and motivating, and that helps them achieve their personal health objectives, as well as our institutional customers' objectives for their community of employees.
Mm-hmm.
And so more to come on this, something we'll probably discuss in subsequent webinars like this. But we are rebuilding our user experience with a complete and centered focus on uh, what engages the end user in terms of personal meaning and resonance. And we start that from the very beginning of our profiling of the individual, profiling them not just on their health risk, but also on these resonance factors, so that we can begin to understand the individual as an individual and customize an experience that they feel is really pertinent to their lives, that is really concretely helping them have a better quality of life and improved wellness through the actual process of utilizing our platform and our technology. And that is a theme that permeates everything else we are doing, all of our business development, our strategic partnership, our sales and marketing, and of course, centrally, our product development and technology evolution strategy. So that's something to look for in the future, and we'll be talking a lot more about that over the coming months and quarters.
Most certainly, and I think you've put that together beautifully. Is that you're orchestrating the connection between psychology, social science, medical science, physiology, and connectedness, all through the platform. So the improvements and the up sort of the uplift that you're bringing from that clinical perspective is more than just from a medical perspective. It's population health and epidemiology coming together. And wellteq is a platinum sponsor of Asia Pacific's largest and most respected wellness conference for corporate wellness across the region, happening next month, and pulling together the lead medical officers and product officers of companies like Qantas and Garmin to speak alongside wellteq around the trends and the evolution and the cutting edge innovations across corporate and enterprise wellness and well-being and health and safety. So you'll be obviously a large part of that. And for those who are interested, there'll be a lot more media and around our LinkedIn profile and our Twitter feed and our website, of course. But on that note, I probably will thank you, George, for pulling that together. This will be available as a recording for everyone on the website. But before we go, please contact out to us direct. We have a string of new news coming through, which is very exciting for us from expansion perspectives, John. And all of that is on the back of what George is leading from a clinical perspective, Andrew on product, and Daniel on technology, and Ollie in growth. So it's pulling this team together so that quarter on quarter, the talk that we're giving right now is demonstrated in revenue growth, which is coming very soon, on user growth, which you'll see, and obviously big corporate brands to utilize the product expansion that George and co are pulling through. So in closing, thank you for your attention, everybody. You will hear from us again in another 3 weeks to extend out this short bite-sized webcast from management. And hope you found this valuable. This will be on the website, and please contact us with any specific questions that we may have not met or addressed today. So thanks everyone for your time, and wish you well for the rest of the day.